All right, everybody. Hi, it's Katie Harris, owner and CEO of Nursepreneurs, and I am here with the chronic care leaders, Meredith and Irina. Do you guys want to say hello?
Hi, everybody.
Hi, everyone.
All right, so we are really excited to share this with you. I got a lot to cover, so I'm just going to go ahead and get started. And I see people popping on right now, so this is awesome. Yeah, I know I was blown away by what you guys did with the last course that just went through. I mean, one, it went through fast, and two, you guys had some really amazing stuff. Really helped the nurses to get started, and you got a ton of like really great raving reviews, which are all over. We put it all over your webpage, and we'll share them with you over the next couple of days. But for those of you that are interested, I know this is a hot topic. A lot of people are interested in chronic care and the chronic care management system. And it is a great business model, guys. It's really, really wonderful. You don't need a website or social media or expensive marketing. You just need one office to work with, and that can set you up. So we're talking today about building a chronic care management system. Do you guys want to talk a little bit about the Medicare Chronic Care Management Program, what that is and why it exists?
Sure. So Medicare started paying primary care providers and other specialists for time that they spent outside of the visits. So everything that providers, let's go doctors or nurse practitioners or PA do in between visits, like calling prescriptions, ordering DME, connecting patients with social support services, just talking to them, advising them. They used to didn't get paid for it. And then Medicare in 2017 said, fine, we heard you, you feel that you're overworked and underpaid, so we're gonna pay you for it. However, it was very, very cumbersome to do the program because if you guys know anything about Medicare, there's tons of rules, tons of regulations, every I has to be dotted and T crossed in order for you to get paid, and when you get paid, if you get audited, not to get in trouble. So, but a lot of providers didn't want to do it because it's still like it requires a lot. And then in 2019, Medicare made more changes to make it better and easier. And in 2020, they made it even more lucrative. And Meredith and I learned about it a while back when chronic care management just kind of became, what I call sexy, and people started doing it. And we recognize that the nurses are in the best position to do this chronic care management program. There are some softwares that you probably have heard or will see. They just provide tons of artificial intelligence, and they text patients or email or call. Well, these elderly patients are not the best in technology, and the program was never made for EI and texting. So nurses are at the great place to be in CCM. We'll teach you everything we know about CCM and how to run it, how to get contract with a doctor or nurse practitioner to get your patient population, and then you can provide chronic care management. The physician or nurse practitioner bills for it, and then you get paid by that provider. Meredith, do you want to add anything?
No, you really summed it up. We have a really great and robust program that just went through, and we already have some nurses signing contracts, so it was a wonderful, wonderful group.
Yeah, so in 2015, the Medicare came out with this research that showed that if you just spend 20 minutes a month with a client, whether it's face-to-face or doing care coordination for them, that you could actually reduce readmission rates. So Medicare went to great time, expense, and effort to create billing codes and to create a system to provide the providers the opportunity to get reimbursed for doing this care coordination. But like what Meredith and Irina are saying is that inadvertently, Medicare made this so complicated that almost nobody set this program up. So here we have a program that's amazing that helps the patients, it helps the providers, yet nobody could implement it because it was so difficult. Mm-hmm. And that's the program that, to this day, how many providers do you think overall, kind of grossly have implemented this? I mean, 90% or like 10% or what?
Less than 20, I think.
11% nationwide was the last stat I saw.
Yeah.
Okay. All right.
So since it's growing, I would say probably less than 20, which means that, 4 out of every 5 doctors that you'll see are not doing it. So the audience is ripe. By now they all heard about it. A lot of them know about it, but majority of them have not implemented yet. So nurses are the great place right now to start doing this.
Yeah, and this program, it saves Medicare billions of dollars, which means it saves taxpayers millions of dollars. And it's relatively simple, and it's for patients who have 2 or more chronic diseases, which is basically most of them, right?
99%, Katie. I don't know anybody who has just one.
It's hard to have just one chronic disease.
Right.
All right. So, Medicare created this code that will pay approximately, it varies in some places, but $43 per patient per month in continuity of the time that that patient is in this system, in the Medicare, the chronic care management system. So for a small practice, for a small, let's say, primary care provider, whether it's an NP or PA or MD, if they have 300 qualifying patients, they could potentially, they're leaving $150,000. So it's already 6 figures with 300 qualifying patients. How many primary care providers out there do you think have 300 qualifying Medicare patients in their practice?
So, Katie, every provider on average, on average, primary care provider has anywhere between 2,000 and 3,000 patients on their panel, and if we'll say half of the patients are Medicare, but a lot of times it's more than half. Out of every Medicare patient, probably 90% or more will qualify, because in terms of patients, really all they have to do is they have to have Medicare and they have to have 2 or more chronic conditions. So we are talking about providers, provider with 2,500 patient panel probably can give a nurse about 1,000 patients to do chronic care management on.
Okay, so we're already talking about a fraction of a business, a fraction of a primary care office can already generate a 6-figure revenue receiving business. So that's what we're talking about today, and that's why this is such a big deal.
Yeah.
And physicians aren't taking advantage of this program because they're too busy with their practice and they don't have time to implement it because it's a little bit of work to implement it. And it's great to have the nurses, and especially a nurse who's trained in chronic care, and a lot of we've seen this, and you guys have gotten a lot of emails about this too, where the nurse says, "Oh, my physician wants me to set up a chronic care management program," because they all want to do it, but it's a big deal. And so the nurse is kind of left like, well, how do I set up a chronic care management system?
Mm-hmm.
Have you guys gotten those calls?
More and more, and I have to tell you, I had one nurse that emailed me a while back in exactly the same situation. She was hired to do it, and 2 months later she resigned because she said there was no support, there was no foundation. They thought just because she's a nurse, she knows how to do it. And as nurses, we all understand disease management. We all understand chronic care management. It's not about our nursing knowledge. It's about knowledge of Medicare rules, regulations, and also how to do it correctly, because this is one of very few programs or CPT codes where we get paid per minute. And as nurses, we're not used to that, right? You're taking care, you're running from room to room. You don't think about who's getting, charged for what. But with this, we're teaching our nurses, how to keep track, what systems to use, what kind of documentation needs to be there. Patients must have a care plan in order to start CCM. We teach that. And I just want to add, Katie, one thing. If we go back to the 300 patients generating $154,000, I just want to make sure that people understand that 20 minutes per month per patient, that's about $40. This is minimum, but you can bill that up to 3 times. So you can bill, 20, 20, and 20. And actually there's more, and we'll talk about that more. But let's say you have a pretty complicated patient, or maybe majority of your patients are going to be, within 40 minutes of care coordination. Just take that money and double it and then triple it. So this is minimum. It's not ceiling, it's just the beginning.
Okay, so in some respects, this is like the worst case scenario, is that it'll only be $150,000.
Yes.
Okay. All right. So the nurses are kind of given this task, like the physician will say, "Oh, go start chronic care," as if it's no big deal, and they're getting frustrated and they're getting overwhelmed because there's a lot of moving pieces to this. This is something that there isn't a textbook, there isn't a course aside from like what we're doing here that tells you how to do this step by step, and that's why Meredith and Irina felt like there was this massive need to help train these nurses either to do this for their physicians or better yet to do it for themselves and create their own business, because it is an operational issue. It's not just let me just bill a couple codes. There's a lot of potential to do things incorrectly in this business and really do some serious financial damage to a practice if you're not doing it right, because Medicare pays, but also Medicare audits, and they taketh backeth. They take their money back. All right. So our goal here today is explaining what this program is, why it needs to be implemented, and how you can make six figures by setting this type of program up. So we're going to learn about the chronic care management program, why nurses run it, what exactly you need to do, and how much you could potentially make in this venture. Because that Medicare readmission problem is a massive problem. Medicare spends an average of $13,000 plus per patient per readmission. And that's why they really wanted this program up and running. And it's taken, where are we, six years now, and we still have less than 20%. So there's a lot of work that needs to be done. And now there's a real push. Like Medicare is like, come on, guys, we really need to do this. And that's why programs like this are so desperately needed. In order to implement the Medicare program, you need knowledge of the system, a system to track, and care managers to coordinate who know what they're doing, and they know what paperwork needs to be done, and they know all the ins and outs of the Medicare process, because you can certainly do this wrong. And Meredith, I know you actually had a software company who was administering care plans that didn't even meet Medicare guidelines, and they asked you to help them fix it, didn't they?
Yes.
Yeah.
And Katie, to add to that, Meredith and I have been demoing probably, 50 or so CCM software companies. They're growing like mushrooms. And there were so many of them that 5 minutes into it, we just got the call because I said, well, can you show me your care plan? And they were like, what care plan? Oh, it's going to be in your physician's EMR. And I said, okay, goodbye. Meaning that there's a lot of software companies, tech guys who leave Epic, who leave Cerner, who leave, big EMR company. They think they know software, which they do, absolutely. And they feel like this is the easy business for them to do. They build the CCM, and then the bonus is going to be RPM. We'll talk about that in a minute. But they build CCM and RPM model without having clinicians. And then they come to, Meredith and I and ask us to review and give them feedback. And so, again, this is just to tell you that you can actually work with the company. You can pay company money to work with them using their software and learn a year later when Medicare comes and audit you that you didn't have a care plan or something was not done correctly. And then Medicare doesn't joke. They'll take all the money back. Because as easy as they'll pay you guys, because this is all computerized system, your ICD-10 codes are correct, your CPT codes are correct. They don't care about your eligibility or medical necessity. If everything matches, computer says, yes, we're going to pay Katie Harris. But then when they'll come and audit, they're going to say, okay, Katie, we paid you for 3 years ago in March when you took care of patient Irina Quishman for CCM. Now show me everything that you've done. And if you don't have certain things, they're going to assume that you didn't do it right for X amount of patients or all of them, and they'll take all the money back. So you have to be very, very careful.
Yeah.
Public service announcement.
The care plan for CCM is different from a disease management care plan, and we really go through that in detail. There's a lot of ways it's different, and all of that has to be incorporated and documented.
Mm-hmm.
All right. So like I said, I'm Katie Harris, owner and CEO of Nursepreneurs, and it gives me great pleasure to introduce Meredith. You want to tell us about you and give us a little background?
Sure. My name is Meredith Dawes. I started out my nursing career in the surgical ICU, where I would have lived and died. I loved being an ICU nurse, but an injury took me away. From there, I worked in pain management. I had a real good grasp on my disease. I have RSD in my lower limb, and I wanted to teach others how to cut down their pain medicine, how to live despite, being in pain. So I did that for many years, and I had finally had enough. And I called Katie and I said, I think I need something different. I need a fresh start. And chronic care management was exactly what I was doing, but I was going to get paid for it. And so I dove headfirst into chronic care management, and it's a wonderful, wonderful career. It's needed more now, I think, than ever with our elderly population, rising. People that are turning 65. I don't have the stat on hand, but it's rising, and our primary care providers are so busy that this kind of takes the load off of them. So, I'm closing in on my 4th office, and it's been very rewarding, and I can't wait to teach you guys all about everything that I have learned.
You're in your 4th office already?
Yes.
Oh my God.
And not only that, Meredith had to say no to 1 or 2 clients that came her way, because after, like, we sat down and kind of went through initially, when you get your first, you make all the mistakes and you really lowball because you just want to get the contract. And as the time goes on and you renegotiate and you get better, then sometimes the contracts come in and they're lowball, and Meredith is like, no, like, I'm not going to take this. You can find somebody else. So soon you'll be in a position where you're going to be dictating, what business you wanted to take upon yourself.
Right. And they probably appreciate that too, because they're like, they know they're lowballing you and you don't accept it, they're like, this woman knows what she's doing.
Right.
And we have Dr. Irina.
Hi, everybody. I am a adult nurse practitioner. I'm doctor of nursing practice, executive track from Hopkins. I started doing CCM. My previous job before this, I was vice president of clinical services over at United Healthcare, and I was leading 300 clinicians, telephonic. After I left, I started doing consulting because I realized that this chronic care management space has been pretty much empty, in the sense that, the program exists. Medicare made this wonderful program. They're paying for it. Providers don't know. Majority of my nurse practitioner friends didn't know that it existed, or they did, and they maybe tried it a while back and they said it doesn't make sense, it's too much, it's too cumbersome. So I started doing consulting, and initially that was my way of paying back. I was doing it all for free, just giving out all the information that I was, able to find. I do CCM for a handful of my patients, to know what I'm doing. And more nurses started coming to me and saying that, look, I'm ready. I want to do this as a business, or I took a class somewhere, and the class was great, but it didn't teach me how to do this, on my own. And then, contacted Katie, and I said, Katie, you're a nursepreneur. Your nurses they should be doing this CCM. It's very lucrative. And Katie introduced me to Meredith, who was already in the process of creating the course, and we met, and it was really love at first sight. She's my work wife or work sister, whatever it is. We work so well together. I love the fact that I bring to the table something from the provider point of view. Meredith does it as the nurse that's taking care of offices. And also in my career, I had multiple healthcare businesses. I owned at one point DME company, medical spa, Medicare certified home health agency. So I understand Medicare, I understand regulations, I understand business. And we just, we put our heads together, and our collective 5 years experience in CCM, knowing that CCM just started in 2017. So together we've been doing this for longer than it actually exists. And, just very happy to bring this to nurses. And we have, I'm sure we'll go over that, Katie, the wonderful feedback and how our nurses are really plugging along and getting contract. But one thing I wanted to mention before I forget is that as a huge bonus, we're also teaching our nurses remote patient monitoring. And this is yet another program that Medicare created, and that goes so well together with CCM. It's literally like brother and sister. And if you're doing CCM, you should be doing RPM for all of your patients. And better yet, some patients might not want to do chronic care management, but they might be great for remote patient monitoring, which is blood pressure check or weight check or blood glucose. And we teach all that. This is all wrapped in one course where, some people charge it as a separate course. And potentially you not only that you double and sometimes triple that income, but think about everything that you provide to the patient. Now you're giving the blood pressure equipment. It's free. They get data. Every time they take their blood pressure, you get data. Doctor gets data. I was able to titrate medications so much easier because I see, I just talked to a provider whose patient was always like 140 over 80 when he saw her. And as he got into RPM, his blood pressure has not been less than 160. So within a few days, I just want to make sure that, he wasn't like a, hypertensive crisis or nothing was going on. And apparently some people, just like they have white coat syndrome, where the blood pressure goes up when they see provider, some people have what's called masked hypertension, where actually blood pressure is much higher at home versus when they see the doctor. So there's tons of benefits that we provide. And it's fantastic for patients, for providers, for Medicare, and of course for our wonderful nurses that want to do it as a business.
Awesome. All right, so these are all the reasons that the Medicare management business is very, very exciting. And once you understand kind of how it works, it opens up so many possibilities that you might not have realized that existed before. So the program actually works. The readmission rates do plummet when this system is implemented. So it's a very powerful, useful system that can solve a very large problem. Not, obviously nothing's going to solve it completely, but this reduces it dramatically. So it reduces readmission dramatically. Medicare pays reliably and consistently, and it can be done as a business, or if your physician has tasked you, or your nurse practitioner for that matter, tasked you to start this chronic care management program and you've got zero idea of where to begin, you are in the right place. So you can start your own chronic care management business, which is what we're talking about today, or you can certainly develop a chronic care management system for your workplace. But I think after you talk to Meredith and Irina for a little bit, you'll see the benefits of doing this and outsourcing it on your own, because it's a lot of this. We're talking about a lot of money, guys. So that's what we want to show you, how this program can change everything for you. So 3 steps to a successful management program. You do need clinical expertise. And we have been through this before where the nurses didn't really know the chronic care management program. And we realized that we had to go back and teach that piece of it. It's good to have clinical expertise before going into something like this. So if you're a brand spanking new nurse, you might want to get a little bit of clinical expertise before going into something like this. Systems organization. This business needs to run efficiently, and you have to be organized. If you're not organized, you are literally going to have 2,000 patients with like moving pieces everywhere, and that will just be a nightmare. And this is not a zero-sum game. This is a win-win-win where Medicare wins, the patient wins, the taxpayers win, you win, the provider, everybody wins in this scenario. So there's like zero downside to this. All right, so chronic care management is exactly how it sounds. You're working with patients who have 2 or more chronic conditions, and the goal is to keep them out of the hospital. You must know the Medicare rules and regulations around key performance indicators. Do you guys want to talk a little bit about clinical expertise and what they need to know?
So for the clinical expertise, I believe that any nurse can walk into this, because as a nurse, you know how to do this. You just need to know Medicare's rules, regulations, and documentation standards. Those are the things you need to know, and those are the things that we're going to teach you how to do.
What about LPNs? Can they do this?
Yes, absolutely.
Absolutely. And we found that LPNs are actually fantastic in doing this. Sometimes we've had practices that hire MAs. MAs can do it. Any what's called clinical staff can do it under the guidance of the doctor or nurse practitioner. But we found that LPNs were a lot better equipped than medical assistants. Everybody gets paid the same here. It's Medicare, so Medicare doesn't pay more if you have a master's degree or you're LPN. but LPNs have tremendous experience. A lot of them worked in a nursing home and assisted living and just usually deal with elderly. So we found that LPNs were in great position to do CCM.
Okay. Okay, and because like we've talked about, Medicare has shown that delivering care 20 minutes once a month or coordinating care. Do you guys want to talk a little bit about the difference between face-to-face and coordinating care and what those 20 minutes mean?
Yeah, 20 minutes. So a lot of people make mistake to think that 20 minutes has to be, so they understand it's not face-to-face. Let's make sure it's non-face-to-face. Yes, you can see a patient. Let's say patient came into an office, you sit down with the patient, talk, it's fine. But normally it's outside of the office visits. So non-face-to-face, a lot of people make mistake and think that they have to talk to patient for 20 minutes, which is not true. What Medicare considers chronic care management services is anything and everything, including phone conversation, coordinating care, getting patients, pre-authorizations, calling pharmacy, getting their medication reconciliation, ordering equipment, making sure equipment's delivered, talking to home health nurse, ordering Meals on Wheels for them. They might need a walker, they don't have a secondary insurance, calling the health department, looking for loan closets. Basically, anything you can do for and on behalf of your patient, considered this chronic care management services. But what's important is we teach our nurses how to document it, because remember, every minute counts. And you can't just say, I'm going to bill for June 20 minutes for my patient, Katie Harris, because I was able to get her free walker. Medicare will pay. They're not asking you. The ICD-10 codes and CPT codes are fine. They're going to come back 3 years later and say, show me the documentation. And you have to document very well that I spent 7 minutes on the phone with the system, with the loan closet, then I spent 4 minutes on the phone with the patient, then 10 minutes researching, how to get a free walker, whatever it is. But we teach them how to document it. So basically it's anything and everything on or on behalf of your patient that you have done to help them stay healthy. It could be pulling the recipe, mailing them the recipe. Patient might be diabetic and they might have a celiac disease. Okay, try finding that, great recipes. But, anything you can do to help them stay healthy, that's what's called chronic care management.
Yeah, and that's what the providers are doing, or maybe not doing at some level. All of that care. Can you imagine per patient? And they're trying to see patients within 5 to 10 minute visits in the office, plus do this additional 20 minutes per patient. And oh my gosh, if you have 5 patients or you see a patient every 10 minutes, how many patients? You could see like 20 patients a day, 100 patients a week, 400 patients a month, and then do 20 minutes of coordinating care for each of them. I mean, it's just not even physically possible to do that. So that's what this is so important.
One interesting piece of information that I like to share and give our nurses as an ammunition when they go talk to doctors is that I forgot who did the research. I have it all written down, but one of those, Harvard or Yale, and they said if primary care provider did everything that is required for them to take care of their acute and chronically ill patients, that means all of the care coordination, prevention, everything that they're supposed to do per guidelines, that would have to work. I hope you guys are sitting 17 hours every day, 7 days a week, 365 days a year, 17 hours a day. So meaning that, of course, everything falls through the crack. It's not providers' fault. They can physically and possibly do it. Meredith had an office who told her that she was getting 50 calls per day from one office, from patients, from just one office. So that office was getting 50 less calls per day. So imagine how many calls per day they get. 200, 300. This is why when we call our doctors, a lot of times it's like, oh, my medication was not ordered. My lab wasn't ordered. This wasn't. One time, my grandfather, I had to take him out physically. That was before EMR. Brought him to the OR to do a surgery. He had a prostate, and he was already undressed on the table in an OR. And then the surgeon came in and he said, I can't operate because I did not get whatever the pre-op orders they were supposed to get. So I had to get my grandfather, who was 87 years old, dressed, drive outside of the hospital, get the lab. I mean, it was ridiculous. So hopefully it doesn't happen like that anymore to that extent, but things still fall through the crack all the time.
Yeah. And Medicare patients qualify if they have 2 or more chronic conditions. And usually these come in pairs anyway. So if you have some sort of diabetes, you most likely have hypertension, or not necessarily diabetes and or hypertension and diabetes, but if you have diabetes, and a large number of our patients do, you have a second chronic disease. And it's what else qualifies for chronic conditions?
Katie, if somebody has a chronic rhinorrhea, chronic runny nose, that qualifies. Anything, any chronic diseases will qualify as long as patient has two. So again, I think Medicare said like 70 or 80% of people have two or more.
And, you know, I just want to add, I saw a really interesting stat. The primary care physician only has, I think it was 12 minutes to spend with their patients. And for any of you nurses out there that work with patients with chronic diseases, I mean, 12 minutes is just not enough. So they need this wraparound care. They need that extra layer of support in between visits. And that's exactly the support that we give them. That's why this is so important.
Yeah, and I imagine, as well, because the patients already feel rushed. So if something's missed, it creates like this, it creates a lot of just animosity. And I think that's a big problem in the healthcare system as well. And this could cut down on a lot of that, especially if they could actually talk to somebody or have get their issue resolved without having to wait a week because the office forgot to call, or they tasked the provider and the provider took 4 days to get back because that was on the bottom of their list of people to call back. So this solves so many issues. Comprehensive care management, the systematic assessment of the patient's medical, functional, psychological needs. It's system-based approach, and it gives oversight of patient self-management of medications. These are all different ways of managing patients. Clinical knowledge is required. You do need a care plan. So do you guys want to talk a little bit how transitional care management fits in here, or doesn't for that matter?
So it didn't 2 years ago. If providers were billing for transitional care management, they couldn't bill for CCM. But as I said, in 2019, Medicare made a lot of great changes. And now chronic care management can be billed together with transitional care management, which is great because Medicare even came out and said, we understand this is not double dipping. These people that coming out of the hospital, they need a lot. They need a lot of help. So yes, you can bill CCM. You cannot bill CCM with home health supervision. So if patients are receiving home health and physician is billing for home health supervision, that they can't bill for CCM. But I think those are just semantics that we'll definitely go over in our class. But it's important to know that not everything, you can bill CCM with everything. And sometimes what I found is people write, on the blogs, and they said, I don't understand why I didn't get paid. And then they said, I was like, oh, well, you didn't get paid because patient was in home health. So we teach all that. So then there's no surprises and nurses know what to do.
Okay. So now the systems infrastructure, almost none of the physicians who are eligible to participate, well, we're going to say less than 20% do so because the coordination and the tracking of this process is difficult to set up, right? It's just cumbersome. You just need to know what you're doing. And it's like any software. If you don't know what you're doing, you have to stop and think about it, maybe invest some hours into it. But it's so much easier. Somebody just says, do this, do this, do this. And it's already set up for you. It's always easy to reverse engineer a system, but when you're trying to put something into place and you have to think how all the pieces go together, that's very overwhelming. That for me, that's like I'm always like ready to buy something that's ready made that I can just kind of put the pieces in, because putting the system together is actually very it can be very overwhelming, let's say. So without having to set up any systems, the physicians can receive some revenue, and this is something that Irina and Meredith teach you, is basically how to negotiate these types of contracts so that everybody wins in this game. Small primary care practices may have up to, a minimum of 300 eligible Medicare patients. So the physicians can earn a significant amount of money, and some of these numbers, the physicians will probably earn less than this because your contracts are going to be better, and you're going to earn more money than the physicians on chronic care management. All right. So, and again, we already have, I think, Irina, you gave some really good examples of what chronic care conditions look like. So it's any two conditions that are considered chronic will be the issue here, but that will be a qualifying patient. The system is key, and it's the biggest hurdle, really, that, everybody says, yes, I want chronic care management, go set up the chronic care management, and, but it's still not happening because that system isn't readily available. And that's exactly what Meredith and Irina have done. They've created a system that's easy, duplicatable, transferable, and it's something that, basically any nurse that's willing to learn from them can do and be successful at. So the different stakeholders in this type of business, you've got the primary care provider, the office manager. Meredith, I know you had some conversations with office managers who were like, maybe hesitant at first to do this, and then we're wondering how they existed without you afterwards.
No, absolutely. They're really your center point, the gatekeeper. And when you're calling these offices, we're going to teach you how to get past that gatekeeper and try to build a rapport and move forward with, that gatekeeper or decision maker that's going to lead you to the physician.
Yeah. And your care managers. So are you guys the ones doing all of the work, or how does that work?
The care managers?
Yeah. What do they do?
So the care managers, they call the patients. They are their care managers. They do pretty much all of the work. And we meet. I'm really big on team meetings. I feel like I know my team, even though I've never been in a room with them. We meet every week. Sometimes we have huddles. And, I'll show you guys how to call all those meetings. And it really brings you together as a team. And I think that's important working in this, remote landscape.
Right. Because if your care managers aren't doing what they need to do, you need to be able to audit them as well. And you need to know what they need to be doing. And you had a scenario like that, didn't you, Meredith, early on?
I did. I had a care manager that wasn't doing the right thing and, wasn't making the necessary calls and documenting that the calls were being made. And through, auditing, like I do every month, I was able to, catch on to that early, and through other methods that we use, KPIs, and the system that we use, we can track what they're doing on a daily basis. So there are systems that I put in place to keep them accountable.
Yeah. And you have to, guys. This is absolutely, if I've learned anything from running a business and running a team, it's that you have to keep people accountable, and you have to have a system that will catch these red flags of, things not getting done. And especially when you're working with Medicare and the bills are, their codes are getting paid and you're receiving money, you have to be able to show the documentation for that. So you can't have an employee or a care manager that's not doing what they're supposed to be doing. So you have to have a system in place that will catch that early on, because you don't want to find out 3 years from now that you have 3 years worth of charts that weren't done properly. Okay. So that's what Meredith and Irina will show you how to make sure, and you will feel confident that your care managers are all doing what they need to do. And they need that feedback too, because maybe they think they're doing the right thing. They need to know what they should be doing, and what is expected of them, and that if they're not doing that, then how to have conversations with them that either are, the conversations that, all right, this isn't working out, or this is how I can help you. And that's where managing a team can be, it can be work. It can definitely be work. And Meredith, I'm sure you've got a sizable team at this point as well.
Yes.
So,
and just to make sure that people know that when you start, you don't start with, a lot of people don't start with hiring LPNs and hiring a team. We start by, Meredith started herself, I started myself. You start by taking care of your first, 50 patient, 100 patient, 200. I mean, I've had nurses take care of as much as 400 patients, which is a lot. Is that a proper English? A little too much. But, once you learn and I have to tell you, some people stop at that because, if you saw with 300 patients, it's $154,000. And if you add RPM, that's double. Like, that's great. A lot of people will say, I don't want to manage a team. I'm making double or triple what I used to make as a nurse, and I do it on my own time, and I am flexible. And that's great. But then some people choose to grow, then they hire, MAs or LPNs, and they continue to grow. So with each person that you hire, you make less money, obviously, because you're paying them. But think about it, the more people you hire, the more patients taken care of. Even if you make $5 per patient, if you're now managing 1,000 patients, that's $5,000 that you're getting without actually managing patients. So again, there's a lot going on, but just make sure you don't think that, oh my gosh, I need to hire people. No, I always say you must start yourself. Like start slow, like with medications, start low, go slow. Once you learn, you can always grow, then you'll decide what to do. But we teach everything, how to manage care managers, where to find them, how to train them, how to interview, everything.
Yeah, that's a great point, because you also don't want to hire a very large team and then not have, the resources for all of them. So, starting slow and starting with yourself, understand the business, understand the expectations and how it works, and then hiring people as you need them. And then you kind of step away, right? And you can make those decisions. You make the choices of how big your company is, how small your company is, and it all just depends on you and what it is that you want.
Quickly, if I can just add something that I really missed with working, I missed the camaraderie of my nurses and my colleagues. And this really gave that back to me. I honestly feel like sometimes I work a 12-hour shift with my team, we're busy, things are going on. So it really gave me back that sense of camaraderie with my nurses. And, it's just something that I enjoy, I wanted to add.
Yeah, I always think that, like, I want to, I love being in the hospital to hang out with the nurses because they're so much fun. And then it's like, and then all of a sudden it's like all this paperwork and chaos. And I'm like, all right, I'm done. That's enough. I want the camaraderie, but not all the other stuff. All right, let's see. Okay, so you're going to have these different scenarios with your physician. So that $154,000 or your provider is going to, you're going to have to pay yourself. There's going to be, so how does that work, you guys, with working with the primary care providers and that income that comes in from chronic care management?
So we usually say, and we teach everything in the class in terms of how to negotiate, but this one is a lot of times the providers come to me and they say, like doctors, and they'll say, I'm just going to hire a nurse, I'm going to pay you consulting fee, teach me how to do this program, and I'll hire somebody to do it. Well, if they hire a nurse full time, we're talking about $80,000 a year, plus fringe benefits, plus turnover. At the end, when they put everything together, they're actually losing money on it. So it's much better for providers to outsource their chronic care management to somebody like Meredith and I, to the nurses who know what they're doing. And then we just, we can't really say split the profit for Medicare regulations, but providers actually bill for it. So provider will bill for it and get paid because it is Medicare code. And then provider pays you for the work that you do and will help you how to negotiate the best fees for you. But a lot of providers that I know stopped doing that because they couldn't afford it. Because they, it just becomes too expensive if you physically have to hire somebody.
Yeah, absolutely. All right. So that is really kind of the chronic care management in a nutshell. And we're going to have you guys ask questions and put them in the chat. But before we do that, I just want to go over really quickly what Meredith and Irina have put together in terms of a chronic care management program to teach nurses how to do this on their own. And it's called the Chronic Care Leaders Program. This is a chronic care management program. They teach you how to set this program up for an office, either as an entrepreneur or if you want to do it for your provider. You can certainly do that. Our website down here is nursepreneurs.com/chronic care leaders, but we're going to go through it step by step what is being offered. This is an opportunity to change lives because the readmission program, it works. And there is robust research that's been done like 6 years ago that shows that it works. It saves literally billions of dollars. You can work from home from this. I mean, neither of you guys work in an office for this, right? You work at home?
Mm-hmm. Correct.
And you can earn money very quickly. All you need, the worst case scenario is if you get a fraction of a primary care office, you're generating a 6-figure revenue. So you can earn money quickly with this once you secure one office, and you can certainly stop at one office, or Meredith is on her fourth office, so you can just keep going. There's 80% of primary care people that need this system implemented, so there's no shortage of people that opportunities here. So this is unlike other products because it's run by nurses who've actually started this program. They actually run chronic care management systems. They run them for other offices. They run them for other nurse practitioners. They've set these business up multiple times. And not only just chronic care management, but they also know the remote patient monitoring. They are in with a variety of experts, healthcare attorneys, office managers, just a strew of people that will be able to help you to get the resources that you need to set this up. So they're providing step-by-step guidance. The program is broken up in 2 modules, and they will help you and show you exactly what needs to be in place before you approach these offices, okay? And that's really setting up that chronic care management system. There's certainly a learning curve to understanding rules and regulations, but they are up on them. I know Irina, for one, is maybe one of the few people that love reading Medicare rules and regulations, but she knows them.
2,500 pages of it every year.
That's crazy. So she's definitely a resource person that you want to have if you don't want to read them yourself. But you definitely need to know them, and she can give you the highlights of what you need to know and maybe even some page numbers. Now, the back office suite, this is what you need to be compliant, right? This is the organizational essence of what makes CCM successful and what makes other CCM systems not successful or really at risk for being audited and getting fees and penalties. You need to know what records you need. You need to know what forms need to be completed. You need to know what care plan, what needs to be in the care plan. All of that stuff needs to be in order. Okay, you have to have this. If you don't have this, this is the reason the offices can't participate, is because they lack this organization in the first place, and they can't show the documentation because they're so disorganized and they don't have a system in place. And it's not a simple thing to just put a system in place. It's a big deal. So Meredith and Irina already have the system, which is what they're going to hand over to you so that you have the system as well. Team management. So if you are going to be a solopreneur and you just want that one office, those 300 patients, the 6 figures coming in, that's up to you. But if you do want to hand some of this off and maybe not be doing all the work and you just kind of supervise and tell the team what to do, you can do that as well. You can have 1 office, 2 offices, 3 offices, 20 offices, whatever you want. But obviously the bigger your team, the more layers and the more kind of your position evolves in what you'll be doing. So something to think about for yourself, what you want. But Meredith and Irina will give you the how to build a solid team, what to look for, what red flags to look for, which are super important, how to build a team so that they are loyal and working with you, because you don't want a new care manager every week. You need a team that's solid and that that works together really well, and that is also a great skill set to have, and that's something that's offered in this program. So Medicare pays, but Medicare also audits. So we need to make sure that the services that are being billed by the physician's office will meet Medicare qualifications if they come in and do an audit. Because like I said, they will come and they'll give money easily, but they also take money back easily. And this could be something that shuts down your business very quickly. So you want to make sure that all of the components of billing get done. Landing contracts, how to get an office to give you a contract, right? Because Meredith and Irina have heard all the objections, and they know how to present a pitch in a way that one will not be, kind of like, oh gosh, this person's here to sell me. It's, oh my God, this person's here to help me. They are my savior because they are going to fix this massive problem that I have. And that's the difference, between selling and building relationships. And that's what Meredith and Irina will show you how to do, is to build these relationships, get past gatekeepers, get to people who can make these decisions, and hear what it is that you're offering, because what you're offering is literally a lifesaver. I mean, I don't even think that's an understatement. That's like you are literally saving lives with this program, because you're reducing readmissions and preventing medication errors and all of those things that come with care coordination and the stuff that's not getting done. Patient management. Medicare is very specific about its roles on patient care. There's the 20 minutes of care coordination. And as Irina had mentioned, you can, if you need to bill more, you can build more. So there's 20 minutes in increments of 3 that you can bill for a patient. And they will show you how to do that when it's appropriate, because it's not always appropriate. And you certainly don't want to be doing that for every patient, because that will be a huge red flag for Medicare. But when it is appropriate, you need to get paid for what you've done. All right, so taken individually, the chronic care system, the back office setup, the team management, knowing how to bill Medicare, what goes into billing Medicare, landing contracts, and patient management has a total value of $13,000, which would be worth it, because if you could secure a fraction of one office, you've already generated $150,000. So $13,000 would be a drop in the bucket. But that's not what we're charging this time around. Even $5,000, and that's what I really think this program needs to be priced at. I think that's a really beyond fair price. It's a $5,000 value for what Meredith and Irina are offering. But they wanted to offer this at $2,500, which I think is crazy. So I would jump on this if you are ready for the chronic care management system. If you want to work with Irina and Meredith to really create this program, whether it's your business or in somebody else's business, it's nursepreneurs.com/chronic care leaders, and the price today is $2,500. They are starting this program next week, so you don't have a lot of time to think about it. When does it start? Does it start Tuesday, Wednesday?
It starts Wednesday the 16th, right?
Wednesday the 16th. Okay. So you want to go ahead.
I'm sorry. I was going to say, I think we'll probably start next week in terms of opening up modules, and maybe the first coaching call will be the week after, just to give people a little bit of time to, to read, to get acclimated to it.
Yeah.
But we definitely, I just want to say that what we keep, I'm saying that, but I just wanted to underline and bold the fact that if you were to do remote patient monitoring, the program itself, it's about $2,500 just to learn that as well, because there's also Medicare regulations, rules, and the time that we spend demoing, every company and all these equipments, we put it all together, and we are just giving that as a free bonus module, where just by adding that to your patients, you're literally gonna A, double the income, and B, provide tremendous value to both the patients and the doctors. So I just want to underline that and say that, and some of the nurses might choose just to start with remote patient monitoring because it's easier. But we've spent months and months and hours upon hours of learning it and demoing it, and we're just going to bring it all together to our nurses. And the price point, Katie, is really, we wanted to make sure that every nurse is successful. We know how hard it is to just, write a check or use the credit card for something that you don't know when you're going to start making money on it. But this is one of those businesses where, because I own the MediSpa and I own DME, like for everything else, you need tens of thousands of dollars initially to rent the space, build it, buy equipment, do the marketing, and then wait for your first client that you'll get paid $150 maybe, or, something. And it does grow, with time and definitely. But this is one of the businesses where literally, if you have a computer and the phone, this is all you need, and you can start making money, and you get paid within the first 6 weeks. So you need 30 days, you need a month of, the CCM, then you bill, and then within 2 weeks, Medicare pays you money. So this is probably one of those businesses where it's like, not only that it's no brainer, but it's so fast. And yes, it's hard to get a first contract. We're not going to lie. It might take months. It might be tomorrow, because one of our nurses, he said, I have a problem, but it's a good one. I just had a call and there's this large practice with 5 doctors and they want me to start. And now my problem is, how do I start so fast? And like, I don't think I'm ready. So you can get it tomorrow if you have contracts and contacts, but it might take you months. But once you get the contract and you get your patients, 6 weeks later, you're going to start getting paid, and you're going to get paid every month on a dot. So that's, this is just, again, $2,500 is just really,
nothing. Yeah.
And
you said something too, you said if you have a phone and a computer line that you can do this. And I would say, in most cases, if, people that have a computer and they want to do online marketing and everybody's jumping in, but not everybody can do that and we've seen this 80% of, almost 100%, honestly, of primary cares have not been able to implement this, okay, because they didn't have a system. So, and now 20%, less than 20%, have some sort of chronic care management set up, which means there's 80%. So yeah, you need a phone and a computer. So it's a super low entry barrier, but the barrier is really high for anybody that doesn't have a system. And if you're trying to figure this out, like Irina said, they've spent hours and hours and hours on the phone with people and trying to figure this out and reading 2,500 pages of Medicare documents and that kind of stuff. I mean, I'm exhausted just listening to it. So if you want to go do that, instead of joining the course, that's great. But you can you don't have to start at square zero in this business. You can start at square 10, where Meredith and Irina already are, and find out how to get those contracts and just implement a system that's already built for you. Trying to build a system by yourself is a colossal pain in the ass. And what I'm saying is that all of these primary carers can't figure it out, and they're leaving literally hundreds of thousands of dollars on the table each office because they can't figure out the system. So you're getting the system. All right, so you're getting the entire chronic care leaders program. They're also doing sales and marketing. So we actually had a sales guy write sales scripts for the chronic care leaders, so that you have a script to help you feel more confident when you're doing these first calls. Because the first couple of calls, you're really you're nervous and you're like, oh my goodness, what am I supposed to say? Well, we have an exact script. And if you just want to read the script, you can read the script, and then as you build your confidence, you don't need the script anymore. But a lot of times having that script will get you over that initial barrier and that initial fear of like, oh my gosh, what do I say? Would tell you exactly what to say. And this was done by a sales guy who, one, was top in his field, 2, loved when we presented chronic care management. He's like, this is the most amazing business model I've seen in a really long time. And he was supposed to write just one script, and he wrote like 4 of them for me, because he's like, I love nurses. I'm so excited about this. And his script has done very, very well. And we're going to give that to you. The software tracking, do you guys want to talk a little bit about some of this stuff, the software tracking, expert master classes, coaching calls that you're offering?
Yep. We'll have weekly coaching calls where, we'll answer questions, we'll brainstorm, we'll think, get to know each other, who's doing what and how we can help. The tracking software, we bring you everything from just Excel spreadsheet that you can do it yourself for free, all the way down to like business management tracking system that will charge you percentage for sure, but they'll give you everything. A phone system, key performance indicators, billing report, the software platform, the timing, everything. So we'll show you how to do it, just bare bones for you for free, all the way down to like a back management system. And again, we spent thousands of hours just researching and working with the different softwares to bring you what you need. We have a Facebook page just for our group. So we are brainstorming together. We are, people are forming groups. They might want to work together. Somebody might get a contract and they'll say, I'm afraid to go in it by myself. Like, Katie, do you want to go with me? You're in my class. Let's do it. We both, live in New Jersey. So we are not cutting the cord after the modules are over. We're still going to meet and offer at least monthly coaching calls for, larger group, and making sure that people communicate, collaborate, and continue to learn from each other.
Right. You want a community for this. You don't want, you can't go into work and ask your friends about it, because Nobody knows how to do this.
Katie, I had Biller ask me questions the other day on my platform, and she's like, I'm billing for CCM. I have these questions. Like, I don't know. And I was able to answer. And I was like, caveat, I'm not a biller, I'm a provider, but I've been doing this for long enough to know like A, B, C, and D. So if you think that, I'm going to go ask my biller, 99% of them will have no idea what you're talking about.
They're going to come back and Irina.
Exactly. They'll ask me exactly.
All right. So then we have the chronic care management system, the back office setup, the team management, what goes into billing Medicare, landing contracts, patient management, what needs to be done for chronic care management, the sales and marketing. So they'll show you how to get these contracts, the scripts, and the sales training to get past that initial gatekeeper. Advanced team management. So as your team grows, the software tracking. There are expert classes that Meredith and Irina bring in experts in the area of the field that will talk to the group. There's coaching calls. You guys said something. I couldn't keep track of all the things that you had. There were so many. The remote patient monitoring. I can't believe that's not on here. I got to make sure that goes in the emails. But you have the remote patient monitoring module, bonus module that will show you how to get started in that. And that is something that can be a standalone business, or it can double your income practically in a chronic care management system. As an entrepreneur, so an entrepreneur would be a nurse who does this for a primary care provider and was hired by them to do it. You can bring massive value. You can change patient lives. You can change the entire structure of the office. Would strongly recommend that you just do this as a business and contract with that office and say, hey, you know what, I'll do this for you, but we're going to do this on my terms, in my system, my way, and you're going to benefit immensely from that. All right, so that's what we have today. Let's see, do we have...
There are tons of questions. I'm ready to answer some of them.
All right, let's start.
So I just wanted to touch on a few questions that were sent to me personally. You do not, any doctor and nurse practitioner can do it. It doesn't have to be primary care. So many specialists do it. Many, I work with, GI groups and endocrinology. So don't think just primary care. Contract with any person that bills Medicare. Let me put it to you this way. Probably not a podiatrist but even, and not OBGYN, because it has to be, Medicare program. So Medicare provider. Do you need certification? No, you do not need certification. If you're considered clinical staff working under supervision of this MD or NP. Clinical staff is anybody, it's MA, LPN, RN, pharmacist. So no certification for chronic care management, but just like we've been saying it, you have to know what you're doing. And we had some nurses, actually, the nurse that provided fantastic feedback to us in our class is certified care manager. She's certified disease manager nurse, but she had no idea about Medicare chronic care management program. So no certification needed. You just need to know what you're doing. When physician contract with your services, you go into EMR to document. So yes, you can, but you have to have really good system of tracking the time. So we're going to give you a few softwares that do it. They do charge for it. We have to be upfront. It's not free, but you can use that software, or we can show you how to do it in an EMR. You just need to have your Excel spreadsheets to write exactly the time that you spend. So you can do it all. New NP credentialing with Medicare. Can I use my existing wellness message? I'm not sure what. Massage company to do chronic care. Yeah, you can use anything and everything. It really doesn't matter. You just have to have patients who have 2 or more chronic conditions, and you can bill Medicare. Yes, you can. And I used to teach this to, and I continually do teach that to nurse practitioners that see their own patients. I just teach them how to implement this and add it to what they already do, so they know how to bill for it. So yes. How long is the course? It is so it's 10 modules. We have 6 weeks, so 6 coaching calls, and then we go into monthly coaching calls. But you can do it on your own pace. We like to open like 2 modules a week, not to overwhelm you, but 6 coaching calls. So think about it as 6 weeks, so a month and a half. Do we teach how to bill? Yes, we do. Again, want to make sure, like, we're not a billers, so we teach you all of the codes, everything you need to do to bill, but then you still need to have somebody bill it for you, and we'll be more than happy to provide all that information to your biller, because majority of billers, again, they do not know, but then they ask me questions, so they research. But yes, we do teach how to bill. And Phoenix J, please don't be sorry for all the questions. We love them. Keep them coming.
That's Lorraine. She's very excited about it. I've spoken to her, and she's great.
And I just wanted to quickly share with you guys, I had some physicians that when I was approaching for contracts, they were hesitant because they didn't know a lot about the program, and they were hesitant about the program actually paying. So I have, some things that I'm going to share with the next cohort that will solidify that. They are things that I've gotten from my biller that, once I take the names off, it's indefinite proof that, yes, this program is reimbursed by Medicare. Bam.
So, Lorraine, I think your question was if you can just do this with your collaborating physician. Absolutely. It's absolutely possible. Does obesity count? Is obesity disease? Yes. Does it have CD10 code? Yes, it does count. And obesity is one of the best things. And you can actually add RPM to it. You can send people scale. They can measure their weight. And if you help them to lose weight, then you'll see how everything else kind of gets, the A1Cs go down, the blood pressure goes down. So obesity is one of the best conditions that I love to work with. So yes, it does count, and it's awesome. What else? How many patients should one LPM manage? Again, we really don't want to get into this is more of a consulting now, because a lot of people have been picking our brains for free and going out and doing it. We'll take the class, we'll tell you everything, but there's really no true number. Some LPNs can only take care of 50 patients. They work part-time, and some can do 400, but we'll be more than happy to share all the pearls with you once we take the course. Yes, you can start the business and then hire case managers. As we said, we like to teach you how to do it, so you start doing it yourself first, and then you can hire LPNs. And that's really the way that we like to teach you. So,
skipping down, it says who does the billing?
Billers. So provider. So let me just be clear. When I say provider, it's doctor, nurse practitioner, or PA. But let me just say doctor. It's easier. So you find a doctor, you contract with a doctor, you provide chronic care management. Whoever the doctor uses to bill for their services, for all of their visits, that biller is going to bill for chronic care management. We don't recommend you going out getting your own biller, because A, you're going to have to pay 6% minimum for the billing. So that's going to come out of your pocket. And B, it's just easier to do it all together with the biller that provider does, and then provider pays for it. So the doctor is going to pay for that billing.
Yes, because there's some things that you can't bill. There's some things that you can't bill CCM with, and that biller will know those things and catch you from wasting your time.
Yeah. We do have a payment plan. It's 2 payment plans, $1,300 each once a month, or you just pay $2,500 as one-time fee. I'm just answering questions.
Yeah, I see.
A lot of about payment plans. The time. So Tamika, we're thinking of offering every Wednesday at 7 p.m. It is very, we're flexible, but I'm teaching at night, and the Meredith has 2 young kids, so we tried also doing it on Sunday in the morning for one group. It worked well, so we'll start with Wednesday night at 7 p.m. Eastern Standard Time, and then we all meet as a group, and if there's changes that need to be made, we'll make them together.
So she asked about the back office suite too, as an electronic program for patient record management.
So we'll bring you all the knowledge, everything that you need to know. Again, starting with Excel spreadsheets. So for free, where you don't have to pay $1, you can just use them and use it in your doctor EMR document. But we're also going to bring you back management software that they will charge you, but they'll provide you everything. Meredith uses them. They provide you with their platform, their software, the timer, the phones, the key performance indicators, the analytics, all the reports. and they'll come in and present, and they'll tell you how much they are charging. And then you make a decision. But we're also going to bring you a software that doesn't have all the blows and whistles, and it's a little cheaper. So then you can have all the options, from doing it completely kind of free on your own, all the way down to, like, true management of the programs. I'm sorry, there was one with the collaborating physician I missed. Can you combine diabetic educator with this? So yes, you can. It's a very loaded question, because you can't bill for diabetic education and also bill for CCM if it's the same conversation, but you can absolutely tag that to diabetic education.
Is 24/7 access to someone required for patients?
It is required, but it doesn't mean you have to be live. You just have to tell patients, number one, you need to find out what the physician 24/7 access is. So they usually have after-hour number provided to a patient, and then you're covered. Of course, patients will have your number, but I always tell my patients, like, I don't work 24/7. This is not an on-call. If you're not feeling well, you can't breathe, you need to call 911, or you can call your doctor after-hour number and talk to them. But that's basically what it is.
So it's really about setting boundaries.
Correct. Yeah. Do you submit the bill for the provider and Medicare reimburses? Yes. So you submit a report, or you can say bill. It goes to the provider biller bills. Provider gets paid, and then provider pays you.
And if you use some of the automated documentation we'll show you, it gives you a really nice billing summary with all the codes, everything listed. It's really easy for the biller to do that.
Yeah. Purvi, how do you know that a patient is not getting CCM from somebody else? It's an excellent question. There's a way to do it, like getting into the Medicare website and checking, which is really complex. What we'd say is we just, number one, when you call the patient, you ask, is anybody else doing chronic care management for you? They know, so they'll tell you. And the other thing is, as a primary care, if you're working with a primary care provider, they kind of take precedence. So if there's maybe a specialist that's billing CCM, then your doctor just needs to call the specialist and say, look, I'm doing CCM for my patients, get off. It happens very rarely. As you know, only 11% of doctors do CCM. So the chance that one patient's going to get two providers billing for CCM is probably very slim to none. But great questions. We're way over hour, Katie. I know there are more questions are coming, but there are. If some people are saying Wednesdays are not good, so just so you guys know, we record every coaching call. We post it. Sometimes our nurses will say, like, I can't make it tonight. Something happened. I look forward to reviewing it. They review it, and then because there's always going to be a time and day that's not good for somebody, so we can't keep switching, but we'll start on Wednesdays. We'll find maybe the best day that works for best people, but then they're always videotaped. You can review it, and then once in a while Meredith and I can meet with some of you on a separate day to just answer questions. And remember, we're always we're always active on Facebook, so we tend, people ask questions, we answer. We make sure that you feel supported and you get the help that you need.
Right. And Laprise, just this one, she said that she's nervous about the doctor hesitation. And, honestly, it just comes down to you knowing the program and how valuable it is. And that will overcome like 99% of the objections is once they hear. And that's what Meredith and Irina teach you, is just how valuable. And then you're not selling. This isn't like sleazy selling or like, let me rope this doctor into this crazy program. I'm trying to help you to help your patients. And I'm giving you an awesome opportunity to participate or not participate. And if you want to think about it, you go think about it. And I'm going to go talk to these 6 other doctors over here. And that confidence will come once you realize how much you're giving and how much you're helping. And that's what we do as nurses,
Yeah. And Katie, like you said, the scripts are ready. We teach you how to do the elevator speech. A lot of people don't even know what it is, but I would say you're trapped in an elevator. You have 30 seconds. What do you say? How do you get a hook to this doctor who's going to open the door and say, you know what, Katie, here's my card. Why don't you call me and set up an appointment with me? So we teach you the elevator speech. We teach you, we practice with you. We help you with your marketing. Our nurses send us their scripts. Like, look, this is my script. What do you think? We edit it. They put it on their website. It's not easy. I'm not going to tell you, like, you're going to talk to first doctor who's going to say yes to you. It happens, but very rarely. But I always say, look, we all live somewhere, right? You have neighbors that might be doctors, that might know doctors. My neighbor, I have so many neighbors that are doctors, or I talk to them and they're like, oh, my cousin is a primary care provider. And I just had this fantastic, it was so nice. One of the nurses emailed me and she was like, I need to talk to you right away. I took my doctor to pediatrician. Pediatricians have nothing to do with CCM, right? She's telling her pediatrician about this chronic care management, how she's so excited and she wants to, learn about it and do it, but she doesn't have any doctor. Pediatrician said, wait, my husband is a primary care provider. He's a geriatrician. Let me, here's his number, call him. So she emailed me. She was like, I need to talk to you right away. Like, I need to call this doctor. So you just need to start talking about it everywhere you are, and you'll find people who will connect you with these doctors who might be interested. So, is it nerve-wracking? Yes. Are you going to be successful from the first call? No. But you have to be passionate about it. You have to be excited, and then opportunities will start knocking on your door. And again, you just need one.
Yeah, and sometimes the way through it, the only way through it is to go through it, right? So you have to make that first phone call is always the worst, and then after that, it's like it's never the first time again, and it gets easier. And the only way something can get easier is for you just to do it. So.
Mm-hmm. And in this community, we're constantly supporting each other. We're constantly talking about it. We're giving you the opportunity to practice in front of the group. So we get you there. It's that Katie's right. The first one is the hardest, but then it'll snowball for you.
All right, guys.
I'm just going to put a link in the chat, Katie. 1 second. I think Purvi asked about what chapter of CMS. There's no chapters, but I can. I don't think I can put a link.
You want to tell me what it is?
Yeah. Oh gosh, that's a long one. But literally, all you have to do is just Google CMS, CCM, and there is a chronic care management toolkit that comes up. But I have to warn you, it's outdated. Just like with Medicare, I think it was in 2019, and new stuff came out in 2020 and in 2021, and it's in final rules. So again, it's very complicated. I don't want to take people's time, but just Google CCM, CMS, and things will come up. And that's going to give you a baseline, but know that there are new codes and other things that came out. Medicare does not update their websites that fast. So that's why I read the final rules, because every final rule, there's a lot more information in it.
All right, guys. So this will close by Wednesday at the latest, because that's when the first coaching call is going to happen. So be sure to join quickly, get in there, and you can get started right away going through the material. And we look forward to working with you and helping you to set up this chronic care management business that I'm super excited about, because it helps so many people.
Good luck. We can't wait to see you. Meredith and I will be honored to have you in our course. We put a lot of, collectively, again, so many years of experience. It took, when Meredith and I met, we chatted a lot, we talked, and I said, how long did it take you to really kind of understand CCM and start doing it? She said it's about a year, and I had the same experience, and we were doing it from both different sides. So we put so much of our knowledge, time, and effort together to come up with this. And we continually learning, we're continually, adding things. So we take your feedback, but the feedback from our previous class was just tremendous. Everybody, we're very happy. People are getting contracts. Again, we're here to help you. We want to see you successful. Some people took the class, Katie, believe it or not, because they just wanted to learn, and they're lifelong learners, and they're not ready to move in with business. But they just want to keep current on everything new that's happening, and they know that maybe in a year when they want to leave the job, that's what they want to do. So it's never too early or too late to learn, and we're here for you. And good luck to everybody.
Awesome. Bye, guys.
Bye.